Good morning and welcome to the California Collaborative's Virtual Policy Forum, exploring outcomes and lessons learned from the state's IHSS Career Pathways program. We're going to kick off the session with a few housekeeping reminders. I can get the slides to change. And table setting as folks settle in, and then I'll pass it off to my colleague, Brandy Wolf, to take us on a deeper dive into the history of the program. To start, today's session is being recorded, and we'll be sure to share the recording link and slides and any resources shared during the meeting in our, in case you missed an e-blast next week. Depending on your security settings, these communications do sometimes get into junk or spam folders, so I encourage you to snoop around there if you don't see it, or you can always reach out to me and I'll happily make sure you have access to the post-webinar content. For anyone who needs or prefers closed captioning, you can enable captions by selecting the CC or transcript icon from your Zoom toolbar. And if you're not seeing that option, it's possible it could be hiding under the extended tools icon. It sort of usually appears as 3 dots. Chat is open to all, so please feel free to send a quick hello message, maybe share the organization you're with or dream travel destination. You may utilize this feature throughout the session at your discretion. We just ask that in the spirit of collaboration, everyone remains respectful and kind to others. Questions can be submitted at any time via the Q&A feature, and we'll do our best to weave those in and get to as many questions as possible during the Q&A discussion. If possible, please be sure to identify which panelist the question is directed to. All right, let's move this along. The California Collaborative recognizes caregiver training as one of several key pieces to building a more robust and equitable, high-performing system of care for the state's older adults and people with disabilities, a demographic that's steadily set to grow through 2060. Well-trained caregivers have the skills and knowledge to provide high-quality care, and that results in better outcomes for recipients, including improved health and well-being. They're better equipped to recognize changes in health status of care recipients and provide timely interventions, which can help to prevent hospitalizations and the likelihood of readmission, as well as early placement into institutional care, resulting in cost savings for both the individual as well as the healthcare system as a whole. Training facilitates better communication and collaboration between caregivers, recipients, and health professionals, resulting in more coordinated and holistic care that better addresses the diverse needs of individuals receiving long-term services and supports. It can also improve caregiver confidence and satisfaction by providing caregivers with the tools they need to perform their roles more effectively, and in turn reduces caregiver stress and burnout. And it's for these reasons that caregiver training intersects with several objectives in the master plan for aging. I won't get into these because our next speaker, Brandy Wolf, who's the Research and Policy Director at SEIU Local 2015, will provide some additional context on this front. And with that, I will transition it over to Brandy.
Sure. Hi, everyone. I'm Brandy Wolf. As Maria said, I'm the Policy and Research Director for SEIU Local 2015. There we go. So just a quick background for folks. Between SEIU Local 2015 and the United Domestic Workers, we are the employee representative unions for the IHSS program. So SEIU 2015 represents about 480,000 IHSS providers in 37 of California's 58 counties, and the United Domestic Workers represents the providers in the other 21 counties. About 170,000 providers, but as we know, it's growing every day. The role of the union is to negotiate with the employer of record, which is the county or the public authority, a memorandum of understanding, or what folks know as a collective bargaining agreement, that covers IHSS provider wages, health benefits, other non-health benefits and terms and conditions of employment. And then the unions also perform representation related duties. Over the years, we have assisted with the implementation of FLSA, the Fair Labor Standards Act, wait time, travel time, overtime for IHSS providers. We assist in the appeals processes, and a number of other representation related issues. We can go to the next slide. So just to give sort of a broad overview, and for the purpose of my portion of the presentation, I am focused on sort of the provider demographics. The Department of Social Services has shared some data recently. So as of December of 2023, we were over 656,000 IHSS providers in California, caring for over 750,000 IHSS recipients. As of January 1st of this year, the average wage for an IHSS provider is $17.23, and the average provider is working about 137 hours per month. You can see from the data here that it is largely a female workforce. 72% are family providers, and 58% live in with their recipients. And something that I think is of note here is that about 32% of IHSS providers who have identified their preferred language are non-monolingual English. So before I jump into this slide, just a couple of other things I would highlight from the last slide. As you can see from the data, direct care workers are earning less than half of California's median annual income. And 1 in 4 direct care workers falls below the federal poverty line. Most of the caregiving jobs are held by women, many are immigrants, and they are twice as likely as other Californians to live in low-income households. There are a number of challenges for this demographic of workers: low wages, stress, isolation, financial stability. And so for all of these reasons, the turnover is really high in this workforce. Every year, there's about 1/3 of the provider population that turn over. It's about 34%. So not only are we as a state trying to ensure that recipients whose providers are leaving the program that population is filled, but also there's the exponential caseload growth that we've seen, and we need providers, to offset and to cover that growth in the program as well. So I think this reality and the fact that we were faced with such a huge workforce shortage in the IHSS space, the governor in 2019 took steps to address this by calling for a master plan for aging. The last thing I'll note is that there is a report by the Legislative Analyst's Office. It's a number of years old at this point, but there are millions of IHSS hours that are assessed for recipients that go unmet, unfulfilled, because there are not providers in the system. And so it is a priority of the union not only to represent the providers, but also to ensure that recipients are getting the care that they have been assessed for and need. So again, just a little background on the journey to where we are and the substance of this webinar. In June of 2019, we began our journey around the master plan for aging. The governor signed an executive order calling for the creation of a master plan for aging by October of 2020. And within that, there was the creation of a long-term services and support subcommittee that also produced a report in March of 2020. in June, when the governor signed this executive order, I don't think he could have predicted that the world would shut down and we would find ourselves in the midst of a global pandemic in 2020. But really, to the credit of those that convened the master plan and those that were a part and engaged in it, we were still able to do the work amidst the chaos of COVID-19. So between September 2019 and March of 2020, the LTSS subcommittee met, provided input on a number of issues, including workforce labor supply and retention. That was included in their report that was finalized in March of 2020. Also from September of 2019 to September of 2020, a full year, the Master Plan for Aging Stakeholder Advisory Committee met 9 times to create a set of formal recommendations in a report to the administration, and that was shared with the administration on October 15th of 2020. And that report had a set of recommendations that included 5 bold goals. I think the one that pertains to the subject of this webinar is the 4th bold goal of caregiving that works. There were 3 strategies within this bold goal. The one that I will highlight is good caregiving jobs creation, and having some professional development opportunities that were tied to some form of increased payment. We'll get more into the specifics later in career pathways. It's paid training and stipends. But this was really, a major focus of the master plan. Something that is not on the slide is also in tandem was an Alzheimer's task force that was set to work in parallel to the work of the master plan. And in that, there were 10 big, bold ideas or recommendations for Alzheimer's prevention, preparedness, and a path forward. And goal number 7 in that report was to introduce a new caregiver training and certification program. So both the Alzheimer's Task Force and the Master Plan for Aging made the recommendation around training for caregivers, whether it be, general training within the industry or specialized training for Alzheimer's prevention. So we can go to the next slide. There's a lot of text on this, but I'll just sort of quickly walk through. In July of 2021, so the master plan report came out in October of 2020. About 8 months later, in July of 2021, as part of the American Rescue Plan dollars, there was a home and community-based services spending plan from the Department of Healthcare Services that included $295.1 million in funding for the Career Pathways program. It took about a year, but through a process of doing some evaluation of qualified training providers and what the capacity and the interest was, the Department of Social Services entered into training agreements with one county and a number of public authorities to deliver courses within the Career Pathways program. And then in January of 2023 is when the agreement was made, or the contracts were executed with Homebridge and the Center for Caregiver Advancement to offer courses through Career Pathways, which we've got some great folks from both organizations that will take us into the next portion. But in the fiscal year 23-24 budget in June of 2023, there was an extension of the program to December 31st of 2024. So that is where we find ourselves currently. The program is up and running. I think that we can talk more later in the conversation, but this was really a historic investment in home care worker training that we have not seen in California. This is incredible infrastructure that has been created, and I think it is a priority of the unions and other panelists and the organizations that they represent to keep this infrastructure in place and keep home care worker training moving forward. So I believe that is the end of my presentation. So I will turn it over to Corinne and Nick.
Hey, thank you so much, Brandy, for walking everyone through the origins of this program. And Maria, thank you for setting up this webinar. Good morning, everyone. My name is Nick Blumenthal. I am the oversee career pathways for Homebridge. Just very quick background on Homebridge. We're an SF-based nonprofit, been around for just about 40 years. And we've been providing caregiving to IHSS consumers in and around the city of San Francisco for that entire time. We have a team of over 300 full-time caregivers, and essentially due to training those folks, as well as providing training for folks across the city, the IHSS registry in the city, we've sort of built up a pretty large internal training team. As Career Pathways rolled around, we saw that sort of as a natural extension of the knowledge and skills and expertise we've gained over the past 40 years, and sort of jumped in to become one of the larger training providers in this program, along with Corinne, who will speak as well shortly here from the Center for Caregiving Advancement. Next slide real fast, Maria. So we're going to talk for a couple of minutes just about sort of initial results. We're a little over a year in, I guess 15 months since Homebridge and the Center for Caregiving Advancement started our classes in January of 2023. So I wanted to talk just high level, what have we been able to do, and sort of some of the initial lessons learned that we've seen in this program. Brandy, I know you spoke some about this, and I recognize this audience generally would have an idea of career pathways. I recognize a couple folks, hello Aurora, from different public authorities in the state, but also just want to make sure that we're all on the same page in terms of what exactly is career pathways. So in that sort of, as Brandy was saying, career pathways started in 2022. And the entire goal is to bring sort of a similar set of training opportunities to any IHSS caregiver across the state. So everywhere from, down south to the northern El Norte and San Diego and everywhere in between, to ensure that everyone has access to caregiver training. And again, sort of as Brandy mentioned, that means there are 650,000 IHSS caregivers who are eligible to participate in these training programs. Which is an incredibly massive number and something that we are sort of thoroughly chipping away at in terms of reaching folks across the state. But that is ultimately the goal of the program, is to provide training to these 650,000 folks across the state. So, what are we training on? And Corinne will speak a little bit more specifically, but high level, there are a wide range of courses from highly general to very specific basic caregiving skills, as well as, mental health for caregivers. And then there are also very focused and specialized pathways across the program. And so this is now sort of speaking about the initial impact of what we've been able to build up over the past 15 months. So these numbers here are sort of joint numbers just from the Center for Caregiving Advancement and Homebridge. And it's pretty crazy when you take a step back. We're offering combined over 200 unique courses. You can see the 5 different pathways that they're sort of focus areas that these courses are offered in. And we're offering them in a couple different modalities. So we're offering them online with instructors, live instructor-led sessions. Folks can also take many courses on self-paced. And then there are also a set of roving instructors going around the state providing in-person instruction for several different courses as well. But this is very much a 200 plus unique courses being taught to these caregivers across the state. And the last thing, just in case we weren't being crazy and audacious enough in terms of the number of unique courses, we decided that, hey, and I guess everyone on this call, as well as the program was set up, is, we need to meet caregivers where they are and make sure that they're able to access training in a way that they're comfortable and truly can focus on the content rather than the language. And so to that end, the program offers courses in 8 unique languages. Every single course offered is offered in these languages across each sort of organization. I should to clarify slightly there. But we have, for Homebridge alone, we have instructors that are teaching 5 of these courses. And then the Center for Caregiving Advancement, Corinne can jump in as well and talk about the courses or the languages they're offering. But again, just very much trying to meet caregivers where they are and ensuring that they have the opportunity to focus on the content being provided. And I'll pass it over to Corinne now to speak a little bit more about the initial reach and impact.
Well, thanks so much, Nick, and thank you, Maria, for having me here today. It's great to see some familiar faces in the audience, and I'm just going to do a shout out to Julianne Coulter, who's been one of our students over time. So good to see you here. A little bit of background on the Center for Caregiver Advancement, also known as CCA. We've been around for 20 plus years providing training for IHSS caregivers in different counties. We have had our biggest footprint in Los Angeles County and have been building up the body of evidence to show the value that training has both for the worker population and for the consumer population. And so we're thrilled to be here and to continue this work in bringing quality training programs to workers across the state. As Nick described, I'm going to go through some additional detail building on what he has laid out. What we have seen for the Career Pathways program thus far is that 18,000 unique individuals have completed at least one course. And so there's so much potential to be able to reach a far larger number of folks across the state. And also knowing that of these 18,000 folks, we have some super users. So we have some folks who have taken 10, 20, 30 courses. So there's a real desire and a real demand of IHSS caregivers to be able to continue taking quality training programs that are offered through this program. We've reached workers in all counties. So all 58 counties have representation in terms of course completion, and 80% of all of the live instructor-led courses in 2023 had wait lists. And so we can't meet the demand. And so we're really excited about being able to, keep this training program going for the needs of the workers and the consumers within the state. Next slide, please. The next few slides are CCA specific, but Homebridge has the similar relevant information. And so what I'm going to talk through is just how we have worked collaboratively between Center for Caregiver Advancement and Homebridge to ensure we're meeting needs of workers across the state, both in terms of the demographics and language needs. As Nick described previously, the language needs across the state, CCA teaches in 8 different languages and Homebridge in 5. And if we look at the number across each of those demographics, what we see is that the majority of folks are English speakers, Spanish being second, Korean being third, Mandarin, Armenian, Cantonese, Russian, and Vietnamese following up. We believe that there's a larger number of folks in the languages other than English who will have a demand for taking these classes, given that that's what we have seen in our wait lists. And you also see that for family members, it's a little bit higher than the state average, which is also the same as what Homebridge was seeing, in that 80%, almost 80% of folks are caring for a family member compared to about 72% at the state that you heard from Brandy earlier. It's important that we continue to talk about stories from workers and consumers as we talk about the value of this program. And what you see on this slide is really a story of one of the IHSS caregivers who's talking about being able to recognize that a consumer had some signs going on where they needed to be tended to, and they didn't have that knowledge before they took the training program. Next slide, please. So the career pathways, as we know, as Nick laid out, has some broad categories in terms of the opportunities for IHSS caregivers. And what you see on this slide are a series of specific training programs that CCA offers, and Homebridge also has a same level of opportunities in the courses that they offer. We thought it was important to lay out some of the specifics, so that way it's clear that the training programs that are offered really meet the needs of the aging population, the growing aging population, and individuals with disabilities across the state. So basic health and safety, what folks know as IADLs and ADLs, Alzheimer's disease and related dementia. This, as we know, is an increasing need across the state as we think about the prevalence of numbers and the rise in numbers as it ties out to the aging population. And as you heard Brandy tie this to the Alzheimer's Task Force and the recommendations. Emergency preparedness, which is even more relevant as we think about climate change and the climate change emergencies that are coming up far more frequently. Autism, which has been a very popular class for us, one of our longest waiting lists, showing that parents who have children with autism have a real desire to have more support for the role that they play as caregivers. And the last three that you see are really on chronic conditions which consumers face across the state. The formats that are offered for these training programs across CCA and Homebridge are the live instructor led via Zoom. As you heard Nick talk about, there's in-person classes that Homebridge offers in different parts of the state, and they also offer asynchronous content so that way workers can take that at times that are convenient for them. And you also heard about the languages that we offer, which is 8 across the state. Next slide, please. We thought it was important to lay out some of the outcome measures that we have been collecting through this process. We could talk about outcomes, I think, for several hours straight on this webinar, but we put just a few slides in here. And these are surveys related to the IHSS providers and their perspectives on what the training did for them. And you see across the top, it's the different courses, the different pathways that were laid out on the previous slide. And you see on the horizontal, some questions that were asked of each of them. And if you look at the numbers, all of them are very high in the affirmative, affirming that the training course has value to the workforce, that they have a better understanding of their role and responsibilities as providers, that the knowledge and skills that they gained in the training program was valuable, that the training environment was interactive and conducive to learning. It provided opportunities to give feedback. It helped communication with the consumer I care for, and it's helped reduce the stress that I have overall caring for the consumer. And all of this is grounded in the consumer-directed model of care in California. So keeping the perspectives of the consumer, the wishes of the consumer in mind is built through the entirety of both CCA and Homebridge curriculums. Next slide, please. This is another slide as it relates to outcomes of IHSS caregivers. We specifically elevated this slide because it's about Alzheimer's disease and related dementia, and again, wanted to connect it back to the Alzheimer's Task Force, the prevalence and the rising prevalence of this condition, and especially the underdiagnosis of ADRD in Black and Brown communities, and how a training like the ADRD program really helps emphasize skills for caregivers and better care for consumers, tying back to the way that Maria introduced all of us today on the value of training for IHSS caregivers. So again, a lot around roles and responsibilities and how this helps for care of the consumer, specifically for those who have dementia or Alzheimer's disease and related dementia. Next slide, please. We also, both CCA and Homebridge, keep, again, the consumer perspective very much in line in the foundation of how we build the curriculum and how we come back to it and make edits to all the curriculum that we offer. It's really important that the consumer voice is part of this process. And so for this slide, what you see in particular is for one of our training programs on emergency preparedness, where we were very specific about working with consumers to understand how the emergency preparedness training impacted them and the care that they were getting from their caregiver. Specifics on emergency preparedness, topics of the training, emergency kits, having an evacuation plan. Again, the rising prevalence of this in particular as it relates to climate change is really important, and just emphasizing how both Homebridge and CCA really keep that consumer perspective as we build and revise our curriculums. We wanted to bring attention to the fact that this program and our training programs have national attention. So the curriculums that I have described in previous slides have been licensed from other states who also train caregivers. You know, they may be a different model, but we think it's important to flag just the value that quality training programs like what we are doing provide to both the consumer and student population, and that it's important for us to keep this program and the impact that it's having going. Next slide, please. This goes back to what Maria mentioned at the front end, right? And the impact that quality training has on consumers. So this is a survey that Homebridge did, and they got feedback from IHSS care providers, and over 85% of them stated that by having a training program, it was reducing medical expenditures. And CCA has done this work also in working with our other training programs and building up that body of evidence on the value of training. And we've continued to find that by training IHSS caregivers, there's a reduction in ER visits, there's a reduction in hospitalizations. Training isn't reversing the course of disease, right? But what it is doing is reducing avoidable visits. And so it really adds to the value of training for the workforce and the quality of care for consumers across the state. Right, and I'm going to pass it back to Nick.
Hey, thanks, Grin. So just wanted to talk briefly about sort of, you know, the impact and lessons learned, and just a couple key points. One of the things we've heard over the last 15 months, time and time again, from the caregivers participating in training was, hey, the content was wonderful. I loved your instructor. This was tremendously helpful. However, my favorite part of the training was the chance to engage with and just chat with other providers during the video call. And they absolutely loved that. About 9 months ago, I was speaking with a caregiver in Placer County whose son suffered a traumatic brain injury about 20 years ago as a 20-year-old. And he's been caring for him for the past 20 years, and talked about how many sort of county level support groups that he would try to build up. And, you know, they would gain a little momentum and fizzle after 12 months or a couple of years, and just felt that sort of feeling of being out there isolated and alone. And the wonderful thing we saw is, hey, we have this unique opportunity, because this is a statewide program, to truly build up a place where caregivers can connect with each other, can support each other, and can engage with each other. So a really thing, you know, a beautiful thing that we're excited with, that in no way was sort of part of our original contract with the state for Career Pathways, but that we've sort of just built into our offering, is an online community. We launched it at the very end of January, and with no sort of outside marketing. It's not even publicly listed on our landing page yet. We have about 4,000 members who've opted in and joined this community. And it's sort of growing just steadily. A couple hundred people each week are joining. And we have spaces on there for very serious topics and also very fun topics. So you can sort of see on the left there, there's language specific channels. There are channels for folks to talk about cooking and food. There's channels to talk about things that people want to celebrate for the day. But there's also, you know, more serious things around a knowledge base. taking care of adults, taking care of children and adult children, and really trying to sort of build on this scale to build out an opportunity in place for folks to support each other. And I think without the scale of career pathways and the statewide reach, you sort of get stuck in these very localized groups that we've seen before and heard about, where it can be hard to find sort of someone who's online at midnight who wants to chat with you. And what we're seeing here is what career pathways can bring folks is that opportunity to very much sort of engage with that. And then I wanted to just put this number up here. This is the last slide, I promise everyone here. 1,600. That is the number of unique training sessions that we'll be offering in this month alone. Each of our training sessions offers 30 seats. So if you think about it, that's 48,000 training seats available to providers across the state. And that really speaks to the scale that jointly we've all reached with this program. When we first started back in January of last year, we were at somewhere around 300 live sessions a month, and we've been able to build up this scale and infrastructure. And what truly, though, is amazing for us is when we launched, we were actually concerned about demand. We weren't sure if people were going to sign up for classes. There was truly a lot of conversations back in November and December of 2022 at Homebridge where we said, we're building all of this, are people going to come? And what's crazy is even though there's a 5-time increase in the number of sessions that we're offering from January of last year to now, we just released about half of our April training sessions last week, and already 85% of them are sold out with waiting lists. So Corinne mentioned that as well in her slide earlier, that 80% demand. Month after month after month, we're seeing this. And one of my colleagues last week just mentioned it's like a Taylor Swift concert and trying to get tickets for it. And it made me laugh, but I think it's really true. It's crazy. There's Facebook groups and there's tons of different things where folks are really trying to understand how to jump in and do that. And I think that number just speaks to this amazing infrastructure that we've all jointly been able to build. At Homebridge alone, we have nearly 40 instructors. They speak 5 languages. We have doctors, we have nurses, we have folks that were trained in special education or teaching children with autism. We have folks that used to run crisis hotlines for caregivers. And last week, we were at an ASA lunch at the American Society on Aging conference, and there was sort of a national audience that was very intrigued and interested in this statewide program. And they very much see it as a potential model nationwide or in other states, sort of as Corinne was mentioning in terms of their content, to really help address the caregiver shortage across the country. And I guess, we're both excited for everything that we've been able to build and feel like we're truly at sort of the tip of an iceberg here, that we, are really starting to figure stuff out and reach folks at a scale that we can start chipping away truly at that, 650,000 plus folks. And I guess I would just sort of end with, would love to hear everyone's comments and questions towards the end here, and ideas that folks may have in terms of what we can do to continue building on all of this wonderful momentum that we've been able to build over the last couple of years here in California.
Well, thank you so much, Nick. I'm going to bring Corinne back as well. And Brandy, put you what I call on stage, but it's really on screen. And I'm actually going to introduce 2 more speakers. We're going to engage in a panel discussion. So I would love to introduce Janie Whiteford, who's the president of the California IHSS Consumer Alliance. Janie, here's your spotlight. And then Kim Rothschild, who's the executive director of the Public Association of Public Authorities. Yeah. There we go. Okay, well, thanks everybody. That was a fantastic presentation again. And I want to give Janie and Kim a chance to reflect on what you've heard so far. Maybe Kim, you can start us off and then we'll jump to Janie.
Great. Good morning, everyone. So the public authorities have the charge of offering provider training and have had so since the onset of their existence. And what was really exciting about the opportunity to engage in career pathways was just the amount of classes that were able to be offered for folks that are in all parts of the state. As we mentioned, some of the remote areas a little bit more difficult to get to, as well as folks coming out of COVID, still a little apprehensive to do a lot of in-person training. This gave everybody an opportunity to really take something that would enhance their skill set, ultimately with the goal of improving care for IHSS consumers. So that was one of the main elements that I think in partnering with several public authorities who also participated in Career Pathways really just escalated the amount of opportunities and just the awareness of different types of educational offerings really enhanced the skill set for everybody in this space. So those were some of the top key takeaways. You know, at some point, a further review or maybe an analysis of the types of growth in the skill set would be helpful. Certainly, this program kicked off quickly and has been 100% at full steam ahead since last year. But even just measuring some of the skill set growth would be super helpful, as well as seeing how that manifested in better quality of care for IHSS consumers. So those are still things that we're looking at and hope to gain more insight into as we continue the program through the remainder of the fall. And in the takeaways that we've had, you know, the amount of classes being offered in the course catalog got off to a little bit of a rough start, with folks all joining in at the same time and unable to get classes. And so there are plenty of hearings where Brandy and Tiffany and others requested the extension. So that was super helpful. So we're excited to participate today, and I'll pass the spotlight over to Janie to add any additional observations and comments that she has from the consumer perspective.
Thanks, Kim, and thanks everyone for your presentations this morning. They were excellent. And I am the current president of CICA, California IHSS Consumer Alliance. We are a membership or a nonprofit membership organization of IHSS advisory committees throughout the state. All counties are required to have an advisory committee, and we currently have 27 counties as members of CICA. And we see ourselves as representing the consumer voice, because our mandate is to give recommendations to anyone in the state, really, board of supervisors at the local level, the IHSS program at the local level, and at the state level, and the feds too, that has anything to do with IHSS, to improve and enhance the program, and to look at areas that definitely need improvement and are lacking. So in that respect, we see ourselves as representing the consumers. We also are very much in favor of provider training, with some caveats. And when this program was first initiated, we thought, oh my gosh, IHSS is predicated on the social model that IHSS consumers have control of their care. So it's the social model of care. Consumers in the program now have to required to hire, train, manage, and if necessary, fire their provider. That's actually within the program. So that comes with a big responsibility for the consumer also. But knowing that there are some of our folks out there who cannot do this. So this training module is really, really important to CICA and our consumers, that these folks get the ability to find out what's going on and how they can better improve their service to the consumers. But knowing that the consumer in the end product has control over their care. Those that can, should, and must, and we really advocate for that. So when we were looking at the training modules, and thank goodness to Corinne and Daniel for their and Nick, sorry, for their the way they modeled them, they came to us to ask what the consumer thought would be really important within these training modules. So they had many focus groups to look at and look at. My organization provided those consumers, and they were from all around the state that actually gave Homebridge. And I know that Corinne's organization did it a little bit differently and has been doing it all along. But this was incredibly helpful so that they knew what the consumer wanted and how they wanted the trainings to be focused. And I know that currently all the trainings are with that focus in mind, which is incredibly, incredibly important to us. Also, one of the things that we were worried about is that these training modules would bring a lot of these folks to the point where they wanted to up their game. They didn't want to stay as providers. They wanted to either do CNA work or go into nursing homes or something like that, where this would enhance their ability to move on. We're not finding that. And we are delighted with that these folks are staying with us. And that I think when you look at it, that we're even going to, when the word gets out there, that this is available, we're going to be getting more consumers coming in, or providers, coming in who see the opportunity to take these classes, and that will hopefully up the number of providers that are willing to work in this space. As Kim said, we are concerned about the extension of this program. We are very supportive of working with the unions, trying to get the rollover of funding so that it continues as long for another year. But what's going to happen when this is over? What a sin it will be to not have the funding to continue this program, which has been so incredible and so well received by both consumers and providers. So I think our advocacy efforts, and CECA will definitely support this moving forward, is to see how we can continue to make this program continue. Another thing I think we really need to look at is more statistics on how this is affecting the relationship between the consumer and the provider. I think that those numbers will be and what they say will be really important in anything that we do as far as advocacy to make this program move forward. Another thing that I think we need to look at, and which is a huge issue for CECA, is consumer education. We are very much concerned about consumer education, and I look at so many of these classes that are being offered now and think, wow, consumers would really benefit from a lot of these. And can we look at the possibility of having consumers and providers go together to some of these? Or can we look at providing opportunities for consumers? This too, and we say that train the providers is going to improve the relationship. I think if we train the consumer, that's really going to improve that relationship. So thank you very much, everybody.
Thanks, Janie, for sharing those thoughts. And I think it's a perfect segue. I had planned to sort of dive a little bit deeper on this consumer engagement element. You gave us a really good overview of what that looked like. But I want to turn to Nick and Corinne and just ask if you could share any lessons learned or takeaways or highlights from that consumer engagement process that Janie just shared with us.
I think that it's really important to continue to emphasize how both organizations, and I'll let Nick speak for Homebridge, but are really keeping in mind the consumer-directed model of care. And I think you heard loud and clear from Janie the fears from the beginning, and we know that to be true, right? We know as we have continued to work in conjunction with public authorities and the folks that you see on this call, that there was a real desire from where we sit for some narrative change, right, on how the value of training can have a positive impact on the retention of the caregiver, because they feel more empowered in their role and they develop better communication with the consumer, because there is a feedback loop in the curriculum of what did you learn in class today? How are you then going back and having a conversation with the consumer about that? So that way there's a differentiation between, you know, what their roles are, and really emphasizing the value of that communication and that connection that they have together.
Thanks, Corinne. Nick, do you want to add anything?
You know, I don't have a ton to add, maybe just sort of, you know, again, time and time again, we've seen the quality of care that folks receive, or, you know, that consumers receive is impacted by the quality of training. And if quality of training from the get-go has a consumer voice, you know, it's pretty self-evident what that can be. And I think earlier I mentioned sort of that tip of the iceberg where we feel we are, and we're starting to figure some things out. What we've loved is, you know, we're actually working jointly with SECA right now on feedback groups. So even though the curriculum is out there, the courses are being taught, we're still sort of going through and holding monthly focus groups with folks from Janie's organization to get feedback and make tweaks. And, you know, it might be small tweaks and things that a lot of folks may not notice, but we sort of feel, again, with the scale we have, can we start making change? You know, even if that just is something that doesn't impact necessarily everyone, but just impacts a good number of folks, we're committed to doing that. And I think that's sort of, again, the wonderful thing where Career Pathways has been, is giving providers or training providers like CCA and ourselves the time to sort of fine tune and truly sort of work with partners across the country and here in California to bring out this sort of very consumer focused training. Thanks,
Nick. Kim, you mentioned that public authorities across California also offer trainings for IHSS providers. Can you share a little bit about how the IHSS Career Pathways training is different from what's already being provided by public authorities?
Sure. I don't know that it's necessarily different, but just more of the trainings and the amount of trainings being offered, especially within, as was mentioned earlier, the specific pathways. So PAs have been offering training, you know, for decades. And one of the things that we've seen an increase of is the need for the Alzheimer's and dementia care. There's a lot of elements now about wellness. And so just the influx of, as I mentioned, coming out of COVID, more of those types of classes to help train providers in dealing with some of the elements that we've seen over the last decade, and those trends that we found being offered through Career Pathways. So I would say that it just enhanced, and it partnered with the public authorities in being able to bolster the education. PAs have done, you know, a really good job of being able to offer specific elements in each county for the education that they have felt was needed based on surveys and feedback and working with their advisory committee. So those elements that were in place were just, you know, able to have so many more people, as we saw earlier in the slides, being able to take classes at a large volume and at a pace that was quickly going through those pathways so that you could get to the different steps along those incentive processes, ultimately ending in being able to work for the 6 months and get that final incentive payment. So so we're really excited about that. You know, as far as some of the elements, you know, there's some confusion with some providers with the difference between what was a PA class, what was a Career Pathways class. Career Pathways offered the incentive. A class through your local PA may not have offered the incentive. So just making sure that some of those communication elements are there. And just being able to articulate that there are two different types of offerings available for providers. So you know, they weren't used to that. And so those are some of the bumps along the way as well. And there were some challenges in the beginning, again, with the classes and being able to maybe have some limits. We saw that some folks would sign up for everything all at once. And so we'd have to go through and just make sure that there's either a limit moving forward or some type of element that could help spread some of the course offerings for more folks who wanted to take them. You know, there's a specific time and a date where classes would open, and then folks had to be available to sign up for those. So those are some of the nice takeaways that we've observed. And then just being able to really demonstrate the commitment to the IHSS program on the consumer side. Their feedback, as Jeannie mentioned, is very valuable, and PAs have been working with consumers, especially in their local advisory committee, you know, this whole time. So I really think just drawing all the attention now to the value that all those stakeholders and collaborative discussions and programs do has made the program much more valuable for the consumer. So I don't know if Jeannie has more to add to that, but those are some of the observations we've seen on the PA side.
Not really. I think that's very well said. But no, I totally agree that, you know, I'm very encouraged by what we're seeing, and hope, you know, just pray that this can continue.
Thanks, Janie. Thanks, Kim. And I would be remiss not to mention, although I don't want to spend too much time on it, is that the IHSS Career Pathways program has a sister program through CalGrows, which is really targeted to professional care providers and family caregivers. But IHSS Career Pathways specifically focuses on IHSS providers. So that's kind of the difference there. And then Nick and Corinne, I'm going to turn to you next. I want us to take a look ahead and ask you, how do you envision the program evolving to meet the future needs of caregivers? Who wants to jump in?
I'll go first, Nick.
Oh, I'm sorry, Corinne, I'm happy to, sorry. You know, I think, Maria, obviously you know, we're optimistic that we can continue building on what we've been building. So I think that's the starting place. Things that we would love to be able to build on, very much as Janie was saying, we'd actually love to build, you know, truly consumer focused courses and start offering those out. And then very much, we'd love to figure out a way to offer, if you will, couples therapy courses between the consumers and their caregivers. And that's, you know, going to be a difficult nut to crack and figure out, but we feel directionally we're headed that way. From a program standpoint, maybe a couple high level things. You know, we often hear, or not often, every single day we hear from providers, are you going to release new subject matter courses? And I think, you know, I speak probably for Corinne as well. We would love to. We would absolutely love to. I think there's a lot of different areas where some deep dives and, you know, would be very beneficial to folks. And it's just sort of a matter of being able to do that. That's not necessarily how the program's been set up. And again, that's okay. That was the phase one of this program. But we would love to be able to sort of take some of these different pathways and focus areas a little deeper. And then I think the other large thing we'd love to be able to do is figure out some proactive ways to bring more folks into the program. Again, you have a caregiver, you know, community or, you know, sort of population across the state. Many of them are immigrants. English is often the second language. And what we sort of heard, generally speaking, when we talk about training caregivers everywhere is, hey, I heard about career pathways. It's a little confusing. Do I go to IHSS? Do I go to Homebridge? Do I go to, you know, CCA? And sort of what we would love to figure out is a way of sort of building cohorts and sort of, you know, proactively reaching out to folks, you know, and building a cohort of, say, 50 Mandarin speakers or 50 Armenian speakers or 50 Spanish speakers, and sort of proactively working with them to get them enrolled, almost give them an orientation session, and then work them through sort of a specialized series of courses that, you know, fit what they need as caregivers. And, you know, I think directionally we're headed in that way, but just, you know, a question of what we can do in the coming months. And I'll pass it over to you, Corinne. I hope I didn't steal too many joint thoughts that we all have.
Thanks, Nick. You know, we're in sync in a lot, which, you know, which is great. You know, a lot of what Nick says, I agree with. I will build on this last point and then lay out a few other options. You know, on this cohort sign up, we've been training IHSS workers before the Career Pathways program for many years. And through those training programs, they were multi-week courses. So you sign up once, you get the entire set of curriculum, 6 weeks, 10 weeks, and you have a single set of students, your coworkers, that you are in within those classes. And we have found that to be a model that really supports maximizing the number of students who are in a class, given that, you sign up for a multi-week class, the teacher, the instructor gets to know you, the cohort of students get to know each other, and they build a community within each of those classrooms. And it's very predictable. And the support around enrollment and recruitment for that, again, also maximizes attendance, and it maximizes from an efficiency perspective how dollars are spent. So that way you don't have empty seats, right? And with the single sign up of the Career Pathways, it allows for a variety of folks to access those courses. But if somebody doesn't show up to a class, you don't have the ability to backfill that with somebody else, because it's a quality training program, so you can't show up 30 minutes late, right? We need to make sure that folks are getting the content and learning in the course. So I think that's a big one that we'd really like to see, is the ability for recruitment, enrollment support, and multi-week, so folks can sign up and complete a full pathway in the order that the curriculum was developed. I think the other thing that I would say is, really getting to scale, right? The numbers thus far are impressive, right? The fact that the state and all the organizations here have been able to build up and stand up a program so quickly, there's a lot of value in that. And then, again, to use that phrase, it's just the tip of the iceberg, 18,000 unique individuals with over 600,000 IHSS caregivers, only increasing every day. So being able to get to scale, I think, is really important, to be able to live in to the goals of the Master Plan for Aging and the Alzheimer's Task Force recommendations.
Thank you both. And then just transitioning to Brandy. Brandy, we haven't heard from you much on the panel, so I want to give you some time. And I think the question I really would have for you and for UDW and SEIU, the union partners, was what's really needed to ensure that we don't lose ground on caregiver training. And I know that a lot of the stakeholders who registered for this webinar also wanted to know what they can do to get involved and sort of support this effort.
Sure, thanks for the question. I think a number of the panelists have touched on this, but we find ourselves in a pretty vulnerable position around the future of this program. It has been explained to us that the way the state has done the funding on this program, that it is all tied, the entirety of the 295 million allotted to this is tied to the American Rescue Plan Act funding, or ARPA funding, which has to be spent by federal rule by March 31st of 2025. What that is currently meaning is that the administration is planning to cease course offerings in September to allow some months for final remittance of courses for payment and all of that. So realistically, right now, we're looking at, 5 more months of training, when we are really just getting in a groove of having more course offerings and getting folks enrolled. We're in a really tough budget cycle for those of us that were around in the 2008, 9, 10 era. we could sigh a little relief that our IHSS program, at least in the January budget, wasn't facing any cuts. But it's really challenging to make asks for what is considered new general fund money. But again, to the points that the panelists have made, I think if this administration wants, and this governor want to demonstrate their commitment to all of the work that has been done on the master plan for aging and subsequent efforts after that, and the Alzheimer's task force, eliminating this program when we have built such an infrastructure really sort of flies in the face of the bold goals that this administration has put forward, to just be really candid. I think there are some action items. I think traditional advocacy is really important right now. We are in the middle of the budget process, the budget subcommittees. The Senate has met, the Assembly is meeting this month on the 17th, the subcommittees that deal with this issue. I think if participants on this webinar are looking to get actively involved, I think calling your own local legislators, making calls or writing letters of support for the continuation of this program into the budget committee members in both houses, the speaker and the pro tem, using methods that I think might be considered traditional to us now. Social media, Twitter. I don't have a Twitter. Maybe that's considered social media. But really, like, calls into the offices, district offices, capital offices, letter writing campaigns if you're part of an organization that has the capacity to submit multiple letters. I think it's just really important that the legislature and the administration is hearing from the folks who are benefiting from this, both on the provider and consumer side. And this isn't the most perfect program in every element. I think Corinne and Nick have both talked about some potential changes that could benefit the program, but if the program is gone, we don't have the opportunity to build on the success that we already have. And the idea that this sort of historic infrastructure is just going to be able to be built up again after it's been dismantled is a very challenging thought to hold. So I would say just stay engaged. We've got the May revision coming up. That's typically around May 10th, and the final budget is due June 15th. So just staying really engaged over the next couple of months, raising your voices and making legislators and the administration aware that this is a priority and we want to ensure that this program continues.
Thanks, Brandy, for that great overview, and hopefully that was helpful to folks that feel the urge to come along and support this program to extend beyond December of this year. There are a couple of questions related to specific course offerings, so I think Nick and Corinne, I'm going to lean on you a little bit here, and we'll kind of tackle them one at a time. The first question is whether IHSS Career Pathways is available to relative IHSS care providers. And I think that was in the presentation as a big yes, but I want to make sure we cover that as well.
It is, yeah. All IHSS providers can access all of the training programs within the Career Pathways program. And I think, as you saw on some of the statistics that we presented, about 80% of those who have taken thus far are family members of sorts.
Thank you, Corinne. Do you encourage consumers and providers to take the training together?
So I'm happy to jump in on this. The current structure of this program is provider focused. I mean, Corinne, I don't know if you want to talk a little bit about a decade ago, CCA was awarded a innovations grant by the Center for Medicare and Medicaid Innovation And they ran a multi-year training program that was, I think, 16 or 17 weeks, and was bookended by consumer involvement. So the first and last components of the training included both the provider and the consumer. I think that model speaks to a lot of what has been talked about and what has come up in the chat about the relationship between the provider and the consumer, and the role of the consumer as sort of the employer of record for purposes of hiring, firing, training, supervising. But this particular Career Pathways program is focused on the provider specifically.
Thanks, Brandy. There was a question about whether the curriculum offers training focused on caring for recipients with intellectual or developmental disabilities. I do believe we talked quite a bit about dementia and cognitive care as well, but I just specific to that population. Corinne or Nick, if you can jump in.
Say that for us, we have a curriculum that we develop specifically related to autism. So it's very specific. And outside of that, for general categories of ID, we do not have a developed curriculum. What I will say is that we're really mindful of building something that has value. And so right now, it's 15 to 18 hours. It's 15 hours as a pathway, right? So 15 to 18 hours of training on a condition that is complicated is scratching the surface on how to truly support and bring a new set of skills for the IHSS caregiver that would impact care for the consumer. And so I think that that's just part of, visioning for the future is how do we better meet the needs of all consumers in really tangible ways that make a positive impact.
Thanks, Corinne. And Nick, anything you want to add or?
I think that would very sort of similar response. I think Corinne answered it quite well for both of us. Thank you, Corinne.
And Ted, who's with us today, is asking about whether there are specific classes on emergency preparedness. Ted, I'm going to drop the link to the curriculum into the chat. I've been warned it's a little hard to navigate, but all of the classes are listed there. And I want to give Corinne and Nick a chance to respond about specific courses for emergency preparedness.
Corinne, I will go ahead and pass that to you. I will be sort of transparent. That is not a subject that we actually offer right now.
Thanks, Nick. And thanks for the question, Ted. We have a very specific curriculum, I think under the link that Maria sent. It's called emergency preparedness, emergency and disaster preparedness, I should say, EDP. We have built and tested this curriculum for several years. In other venues, it's called caregiver resiliency teams. And the framing on the curriculum is that it prepares caregivers on how to better prepare for, respond to, and recover from climate-related disasters, which is synonymous with emergency preparedness. And so just a plug, you can go to our website and there's an impact study report. We did a briefing with state leaders and that just shows the value of this particular training program and statistically significant knowledge gain for workers, as well as the consumer focus group, which you saw a slide from earlier, that just consumers very much felt that by having caregivers trained on this particular emergency preparedness course, that they felt better prepared for in times of emergencies, again, knowing with the increase in climate-related disasters.
Thanks. And Janie, I see you've got your hand up, so I know you want to jump in. You're muted, Janie.
Yep, I just unmuted. Thank you. I just, the thought just came to me, and now it just went out of my head. I can't believe this. Oh my God. You'll have to give me a minute. I'll put my hand up again. Sorry.
No worries, Janie. We can circle back. All righty, let's go on to our next question, which was really about how this program has been promoted to care providers. Anybody who can jump in and share a little bit about what that promotion has looked like, and then how can we build on these efforts to ensure that all providers are aware of the opportunity?
Yeah, I'm happy to jump in first from the union perspective. And thanks for the suggestion for folks. Purple Text is a texting platform that we use within the union to reach out to our members. But I think there have been a couple of issues on the education and outreach. It is my understanding that there is not sort of recruitment and education funding to the vendors who offer the trainings. There is no funding for that or for those efforts. And so it's largely been put on the state to do the education or raise awareness that this is available, and not to be dismissive or disparaging of the state, but putting something on your website or maybe putting a banner within the electronic services portal is not really a very robust recruitment process. And so on the union side, I think what we have feared a little bit is doing a mass promotion of the availability of these courses, only for providers to go on and essentially crash the system, get frustrated, not be able to navigate it, not be able to enroll for any courses. And so it's been kind of walking this fine line between when more course offerings are going to be made available and how we do some outreach and education to our members. I think all of this speaks to sort of the growing pains in a program this large, and to our position that this program needs to continue in order for us to work through some of these things and get more individuals aware that this is available. And, you know, when they go and navigate the course catalog, they're not leaving feeling frustrated or excluded from the process.
Thanks, Brandy. Anybody else want to add on to that? Oh, and Janie, you've got your hand up.
I knew if I waited a couple of minutes, it'd fly back into my head. Yeah, I just wanted to say that for our within SECA, we have always been really concerned knowing that there are consumers out there who cannot manage their own care, and that this has been a concern of ours. And what do we do about that? And I think that this program is one of the ways that we can ensure that those folks that cannot manage their own care, as long as the training they get, you know, speaks to that issue, will really be beneficial. And, you know, there's other ways that we need to look at this, but I think that we need to think about that, about those folks, whether they have dementia, Alzheimer's, or whether it's a mental health issue, whether it's you know, those kids that have DD issues that are, you know, not able to manage their own care, and then of course grow up and they're adults with the same issues. But I do think that, and I thank both of the programs, because they're doing a great job with that, even in that population, espousing the consumer position on it. Thank you.
Thanks, Janie. And Nick, I know you had your hand up too, so I don't know if you want to add to outreach or what Janie just said, but I want to give you an opportunity to jump in.
Yeah, you know, maybe sort of just building on what everyone has been saying, you know, to stress there was no budget for proactive outreach on, you know, sort of from a training provider standpoint. And something that I know that Corinne also is interested in. And, you know, even for the 6-month extension that's starting now, we talked to the state and we said, hey, what we'd actually like to build is an operational marketing team. And what we meant by that is very much a sort of a group of specialists focused on holding people's hands and getting them across this finish line? Could we get them enrolled in 5 different courses? Could we train them on how everything works in their language and so on and so forth? I don't want to speak, I don't want to speak. Let me say, I think there's just been a lot of confusion around this program from day one. A couple of things that have, we've heard, and maybe what I want to say first is the folks at CDSS who we deal with on a daily basis have been wonderful. And I truly think they've been great partners and are trying to keep their head above water. And it is like a tsunami is hitting them every single day with caregiver questions coming at them. And I think sort of speaking to that confusion, our team of student support specialists, we have answered 35,000 emails since the start of this program, let alone sort of things in public forums on Facebook and elsewhere. And consistently, the questions we're getting from providers really aren't for us. They're more around the general program, how do I get paid, and so on and so forth. And I think that sort of just speaks to that, taking a step back and saying, again, we're at this tip of the iceberg. How can we communicate this program better? How can there be sort of a unified voice of support and sort of outreach and support, making sure that folks understand truly, hey, Homebridge and CCA are different organizations, but we're offering all training that sort of flows into this. And so we'd like to get there, but I do think, you sort of talk about figuring that out. And what we've heard from providers is, they went and tried to enroll in classes back in January, February, March of last year. They got there, classes were full. It was a little confusing. And they'll sort of tell us, hey, online learning wasn't really for me to start with. And I went there, I got a little confused, and I'm good. I'm just going to go on with my life. And again, we're excited with this 18,000 folks that we've reached, but that's sort of a lame excuse for us as a training provider that, hey, online learning is not for them. We see that and we say, wait, how do we hold their hand? How do we get them comfortable? How do we sort of cross that divide? And we would love to continue sort of building towards that in the coming months.
Yeah, absolutely. It sounds like a lot of emails with questions. And that makes me think there's a lot of people who are interested, like you mentioned. Now, Brandy, I know you have to jump at 11:55. We're a couple minutes shy, so I want to see if you have any closing thoughts or comments. If you want to just jump, go ahead.
No, I did see, I wanted to answer a question by Emmanuel around the training for the home care services branch license requirements. I just want to clarify if I'm understanding the home care services bureau within CDSS is to license and certify on the private pay home care side, not IHSS. And so this particular training in its current iteration of the Career Pathways program is only for IHSS providers. I think there was also another question that had come in. It is all IHSS providers, whether you are a family provider, non-family, live in, you don't live in, it's any IHSS provider, but it is not in the private pay market, which is licensed through a different part of the Department of Social Services. And I guess my closing remark is really just, I think when the administration made this historic investment in home care worker training, it was an incredibly exciting moment. There was a lot of momentum at the federal level around Build Back Better and around President Biden announcing care as vital infrastructure within the economy. We know that the investments we wanted to see in Build Back Better did not come to fruition. But having, almost $300 million in training money for this workforce really signaled to those of us that have been in this space for a long time a shift in how people are viewing home care and the dignity of the work and the relationship between the provider and the consumer. And it just feels really disappointing and disheartening that we may see some steps taken back. And so I would just empower everybody to reach out to your legislator, to be loud, to be vocal on the need for this program to continue. And thank you for the opportunity to be here. I'm sorry, I got a jet.
Brandy, Fantastic closing thoughts. All right, everybody's excited. Everybody's calling their legislators. Um, bye, Brandy. I do see we're getting really close to time. I know there's a couple more questions. A question from Greg about whether IHSS Career Pathways, if the data is showing any increase in the number of new IHSS workers. There's a question about the data around courses offered. Nick, I see that you're typing out an answer. Julian has a recommendation about support for people to enroll in classes, particularly those that may not be as comfortable using the technology. And I would invite speakers to go ahead and respond to those in Q&A if you can. But I think for us, it's probably time to pivot and not to questions. We did that part. To pivot to just some closing comments. So what I'd like to say is, well, okay. So first, just a big shout out to our speakers who really put a tremendous amount of energy into the program, into today's presentation. And on behalf of the California Collaboratives membership, I just want to thank you for sharing your time with us. And thank you for lifting up California's caregivers. For those joining the webinar today, just a quick reminder that the recording and materials will be shared out next week. So keep an eye out for that and reach out if you don't see it. I'm happy to forward or share what I can. And just for some parting words, I want to just highlight that quality caregiver training results in better care and better outcomes for consumers. And it's a critical component of how California can prepare for a more age and disability friendly future where all of our community members are valued, are treated with dignity and respect, and are supported to ensure maximum independence. The caregiver training, quality caregiver training, results in the kind of care that mom, dad, uncle, brother, grandpa, grandma deserve. And so we really look forward to a continued partnership, continued dialogue, and the work that's in progress and will continue to be in progress to build out that high quality long-term services and support system in California. So thank you for joining us, and we look forward to connecting again soon.